Hello everyone, in this video we are going to discuss about high altitude sickness. So when a person reaches high altitude, that is more than 2500 meters or more than 8000 feet of height, there will be decrease in the atmospheric pressure. This causes decrease in the partial pressure of oxygen in the inspired air, and there will be decrease in the partial pressure of oxygen in the alveoli, and this causes decrease in the arterial oxygen tension, so causing systemic hypoxia. This leads to three conditions. There will be cerebral vasodilatation to maintain the oxygen delivery, and there will also be increase in the capillary pressure causing vasogenic cerebral edema, causing high altitude cerebral edema, also called as HACE. And in the lungs it will cause pulmonary vasoconstriction due to hypoxia, and there will be increase in the capillary hydrostatic pressure causing non-cardiogenic pulmonary edema, also called as high altitude pulmonary edema or HAPE. And there will be endothelial dysfunction causing leakage of fluid into the interstitial spaces. So this systemic hypoxia, this will cause acute mountain sickness. The person will present with headache, fatigue, nausea, dizziness, sleep disturbance. In all the cases of acute mountain sickness, whether it is mild or severe, the person should immediately descend at least for about 500 to 1000 meters, and supplemental oxygen should be given. The person in the treatment of acute mountain sickness, rest should be given, halting of further ascent, proper hydration, acetaminophen for headache, antiemetics for nausea. Acetazolamide is given as a part of treatment and also as a part of preventive care. As a part of treatment it is given because it will increase the renal bicarbonate excretion, which promotes the metabolic acidosis. So this metabolic acidosis will stimulate the hyperventilation, causing increase in the oxygen intake. It can also be given as a preventive measure 1 to 2 days before ascent, so it can prevent the acute mountain sickness. So next is high altitude cerebral edema. In case of high altitude cerebral edema, the person will present with acute mountain sickness, severe acute mountain sickness with confusion, ataxia and altered mental status. Here immediate descent with oxygen therapy along with steroids are given, that is dexamethasone 8 milligrams loading dose and 4 milligrams every 6 hours it is given. Steroids are given because in order to reduce the cerebral edema and also decrease the inflammation. If the person cannot descend, then portable hyperbaric chamber the person can be put in a portable hyperbaric chamber. Next is high altitude pulmonary edema. This can occur with or without acute mountain sickness. It is a complication of high altitude ascent, or it is a part of high altitude sickness. So in cases of high altitude pulmonary edema, there will be dyspnea at rest with cough, hemoptysis, tachycardia and cyanosis. In these cases also immediate descent with high flow oxygen should be given along with nifedipine. 30 milligrams dose extended release can be given, because this will promote the pulmonary vasodilatation, because what happens in hypoxia is pulmonary vasoconstriction. So in order to promote the pulmonary vasodilatation, nifedipine can be given. And most thing should be the person should avoid overexertion, avoid cold exposure and avoid further ascent. These can trigger the high altitude pulmonary edema also. So in just high altitude sickness, it consists of acute mountain sickness and HACE and HAPE. HACE is high altitude cerebral edema and HAPE is high altitude pulmonary edema. In all the cases of acute mountain sickness, what a person should do is immediate descent with supplemental oxygen. In case of acute mountain sickness, the person can be given preventive measures as acetazolamide can be given, and acetaminophen, antiemetics can be given, and acetazolamide can be given as a treatment. In case of high altitude cerebral edema, along with immediate descent and oxygen therapy, we can give dexamethasone to prevent decrease the cerebral edema and decrease the inflammation, and portable hyperbaric chamber can be used. In case of high altitude pulmonary edema, that is HAPE, immediate descent with high flow oxygen with nifedipine, and person should avoid overexertion, cold exposure and further ascent.